Assalamualaikum and hello everyone. My name is Adlin Akila. So, in this video, I will explain why CPR is important and show you how to perform it correctly. Imagine witnessing someone collapse suddenly. Would you know what to do? Every year, thousands of lives are lost due to cardiac arrest. But immediate CPR can double or even triple the chances of survival. CPR or cardiopulmonary resuscitation is a life-saving skill that everyone should know. Maybe some of you might be wondering, what is CPR? CPR stands for cardiopulmonary resuscitation. It is a life-saving emergency procedure used to restore blood circulation and breathing in someone who has suffered cardiac arrest. CPR involves performing strong rapid chest compression to keep blood moving through the body, ensuring vital organs receive oxygen. This technique is crucial when a person is unresponsive, not breathing, or only gasping. Acting quickly can make the difference between life and death. Again, CPR is a critical life-saving skill that can make all the difference in an emergency. Without oxygenated blood, brain damage can begin in as little as 4 minutes. Performing CPR helps keep blood flowing to the brain and other vital organs, reducing the risk of severe damage. Most importantly, CPR is significantly increase a person's chance of survival by keeping them alive until professional medical help arrives. Your quick action could be the reason someone gets a second chance in life. Now, I will explain how to perform CPR. Step 1. Ensure safety. Before rushing in, always check the scene for potential danger, like traffic, fire, or falling object. Remember, your safety comes first. Check the person by tapping their shoulder and loudly asking, "Are you okay?" If no response, call 999 immediately or ask someone nearby to call for help. If available, ask a bystander to find AED, which is Automated External Defibrillator.
We're going to ask them a few questions and we might actually even pinch their shoulders to see if they'll respond. Hello, can you hear me? What's your name?
Step 2. Position the person and open the airway. Carefully lay the person on their back on a firm surface. Kneel beside their chest and tilt their head back slightly by lifting their chin. Open their mouth and check for obstruction such as food or vomit. Remove any loose obstruction carefully.
Next, we're going to check the person's airway. We're going to tilt their head back, open up their airway and check if there's anything obstructing.
Step 3. Check for breathing. Place your ear close to their mouth and listen for breathing for no more than 10 seconds. If you hear no breathing or only occasional gaps, begin CPR immediately. If the person is breathing normally but unresponsive, place them in the recovery position and continue monitoring their breathing.
No obstructions, we're going to check if this person is breathing. So we're going to look over the person's chest, and what we're looking for is that normal gentle rise that our chest does when we're breathing. We're going to listen for any sign of normal breathing, and we can also feel that chest.
Step 4. Give 30 chest compression. Place one hand on top of the other and clasp them together. Position your hand in the center of the chest, slightly below the nipple line. Keep your elbow straight and use the heel of your hand to push down hard. Compress the chest at least 2 inches deep at rate of 100 to 120 compression per minute. Allow the chest to fully rise between compression.
Person is not responsive and they are not breathing, or they're not breathing normally. So we need to start CPR. To locate where we're going to place our hands on the person's chest, we can go to their underarms with our pointer fingers coming to the center of their chest, and then with the heel of our palm, we're going to place the hand down, keeping our arm straight, interlocking our other arm, leaning over the person's chest, and we are going to push. Now we're actually going to push hard and fast. We're going to push about a third of that person's depth of their chest, and we're going to also allow for that chest to rise back to its normal position. Now we're pushing at a beat of about 100 to 120 compressions a minute.
Step 5. Give 2 rescue breaths. Tilt the head back slightly, pinch the person's nose shut, and place your mouth over theirs, creating a complete seal. Breathing gently but firmly into their mouth until the chest rises. If the chest does not rise, retilt the head and try again. If the chest still does not rise, the person may be choking. Check for obstruction.
If we're willing and able, we can do rescue breaths. So to do a rescue breath, we're actually going to tilt the person's head back, pinch their nose, open up the airway, and I would put my mouth over the person's mouth, forming a seal, and I would offer 1 breath, 2 breaths.
Step 6. Continue until helps arrive. Keep repeating cycles of 30 compression and 2 breaths until the person starts breathing on their own. Emergency responder arrive and take over. Also, an AED is available and ready for use. Make sure follow its instruction immediately. I will share with you some tips and precautions when you perform CPR. So when you perform CPR, you have to push hard and fast in the center of the chest. Allow the chest to fully recoil between compression. Also use hands-only CPR if you are untrained. Focus only on chest compression instead of breathing. What you must not do when you perform CPR, which is stop CPR too soon. Make sure keep going until helps arrive. Second one, bend your elbow or press too lightly. Compression need to be deep and strong. The last one, perform CPR if the person is breathing normally. CPR is simple, but it can make the difference between life and death. In just a few minutes, your quick action can save a life. Learn CPR, stay prepared, and be ready to help in an emergency. So, that's all.